Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore, a proactive approach to healthcare. That's what we're talking about today. A very important topic because it's better to be proactive and then reactive to your healthcare. So here to talk to us today about that is Victor Rasor, and he is with Pacific Point Home Health. Victor, how are you doing today?
I'm doing great. How are you doing?
Good, thank you. Thank you for coming today.
Absolutely.
You and I were talking about this subject, how it's definitely way better to be proactive than reactive, and your company can really help with that. Tell us a little bit about Pacific Point in general.
Yeah, absolutely. Thanks for having me again, and we appreciate the opportunity. At Pacific Point Home Health, we're actually clinically owned and operated. One of our owners is a nurse, but as far as Pacific Point Home Health goes, it's a proactive approach to health. So instead of ending up in the hospital, our goal is to keep patients out of the hospital and to keep them independent in their homes. Let that be an assisted living or at their actual home. Residents, and it's basically just to keep them out of the hospital by doing exercises, range of motion, reduce falls, making sure medications are managed properly at home, and this is all provided by skilled nurses, licensed registered nurses, as well as licensed physical therapists.
Got it. So there's a difference between home care and home health.
Yes.
Home care, obviously you're taking care of the activities of daily living, but non-medical. But your folks are nurses, and so they're even more hands-on with the medical side too.
Correct. Yeah, so there's it's a big misconception as far as home health versus home care, but home health is the skilled part of the home health, and then home care is usually caregivers who are non-skilled, so they don't have like the licensed registered nurses that we have. Another misconception between home health and home care is that home health is covered through insurance. Like Medicare covers 100% of home health services. Other insurances as well, cover partial or even fully our services. And then home care for caregivers is all out of pocket, unless you have a secondary insurance of a long-term health insurance plan, which is pretty rare these days. They used to offer back in the day.
Right.
So,
they don't offer those anymore.
No. So, but it is very different as far as home health being skilled and home care being caregivers.
Got it. And we talked a little bit about some of the disciplines about home health. What are some of those things that we should be looking at?
Yeah, so like for our home health services, they include like registered nurses, licensed physical therapists, occupational therapists, speech therapists, medical social workers, as well as home health aides to assist with bathing and grooming a couple times per week.
So it's really a holistic approach
Correct.
to taking care of someone. I love the speech therapist even.
Yes.
I've never heard that before.
Well, for recent Parkinson's patients or recent strokes, that focus on swallow evaluations or even just speech in general, as you age, these are some of the things that can put patients in the hospital. So along with falls as well as not managing their medications properly at the home, wound care if it gets infected. So our goal is to keep patients at their home, independent, and to have our services to the point to where they don't need us anymore. So
yeah,
that's our goal.
And that's powerful. And I'm sure there are situations where they do need you continually, and you can provide those services.
Absolutely.
But I'm sure there's lots of success stories that you have.
Oh, yes.
Where they've come to you and they graduated.
Yes, absolutely. So patients, while they're on service with Pacific Point Home Health, we try to get the patient to the max potential that the patient can get to. So once the patient has reached their max potential, we have to discharge them per Medicare guidelines because our goal is not to keep billing their insurance and to keep them on service. Our goal is to get the patients independent as quick as possible and with the developed care plan at the evaluation, and to discharge the patient once we've done all that we can do.
How long? I mean, it varies because every situation's different, every ailment's different, but is there an average as far as how long it takes someone to sort of graduate off of the home health?
Yeah, it just depends. Like for a patient who has a wound care, has a wound, as obviously it's going to be a nurse that visits a couple times per week for several weeks. For physical therapy, specific orthopedic program, it may be 3 times a week for 4 weeks. It could be 9 visits total for a total joint aftercare. So I would say the average is between 6 to 8 weeks, I would say, but it can definitely extend to further. But I would say within the 6 to 8 is probably the normal, if I can even say normal.
Yeah, right.
Because there's no
there's
normal
no such
patient.
thing as normal.
Correct.
Right.
Yes.
And you're brought in. Your company's brought in pretty much when they are discharged from the hospital or skilled nursing. Is that right?
Well, correct. So when a patient is discharged from the hospital or skilled nursing facility, they're 99% of the time set up with home health, and that's so they don't end up back in the hospital.
Right.
So Medicare doesn't like that because that's more hospital bills for them.
Right.
But is an independent doctor's office, like an internal medicine doctor or a geriatric doctor, can order home health at any time with the doctor's orders. Of course, there has to be a skilled need. But they can write an order if a patient's already in the home. So if they've recently fallen and they didn't go to the hospital, because sometimes patients refuse to go to the hospital, and so our physical therapists come to the house and work on strengthening exercises as well as range of motion and doing a safety evaluation of the home. So if there's recommendations for durable medical equipment, it's called DME. For like safety grab bars in the shower, things like that, we can make those recommendations in the home to make it more safe.
Yeah. And I know that hospitals really do not want patients to come back because aren't they dinged if they do?
Yes, they are, as well as skilled nursing facilities. So it's something that we track very closely as far as higher risk patients to be rehospitalized based off of diagnosis. Maybe it's the medications that they're on. So we really follow those patients closely, as well as the ones that aren't in the hospital, because we don't want them to end up in the hospital either. So.
Do you guys track at all about your success rate as far as people who don't have to go back to the hospital versus those that do? Yeah,
absolutely. So we actually just got up to 4 stars, 4 to 5 stars on our survey, and as far as quality ratings, and so our hospitalization rate, I believe, is down to about 9%, which is quite below the national average of 13. So
wow, that's great.
Yes.
So less than 10%. Less than 1 out of 10 person has to go back to the hospital.
Correct. Yes, which is awesome.
That's fantastic. Yes. That's success stories for sure.
Yes.
And your services are throughout San Diego County?
Throughout San Diego, everywhere from the border in Chula Vista all the way up to Fallbrook, and then out to those rural areas like Ramona, Alpine, Lakeside, even Paula, and Valley Center.
Got it. All right. Anything else we should know?
As far as Pacific Point goes, like you said, as far as the hospitalization rate is a little bit lower than the national average, which is great. But that just comes from the top down for Pacific Point, being clinically owned and operated. Our field staff are 100% prepared in the field. They have all the supplies needed. I love looking at their trunks sometimes because they're all set up. They got all the wound care stuff.
They're ready to go.
It's all nice and packaged up. But we do have a great orthopedic program with Pacific Point Home Health. For physical therapists visiting patients in the home after their orthopedic surgery. So I would say that's our specialty right now as far as our orthopedic program.
That's awesome. That's great. Well, more information for Pacific Point is on screen. You can contact them via phone, via web. All their information is right there. You can give them a call or visit on their website. For those of you who are listening on your favorite podcast channel, you can't see this, but it's going to be in the caption, so you can take a look at that and learn more by giving them a call or website that way. Victor, thank you very much for sharing.
Absolutely, thank you, and appreciate having me here.
Yeah, my pleasure.
All right.